another pressing story because the center has announced a major nationwide push to tackle childhood diabetes. All children from birth to around 18 years will now be screened under the government's revised Rashtriya Bal Swasthya Karyakram or RBSK 2.0. The new policy will provide free lifelong diabetes treatment through the public health system, including insulin, medicines, blood sugar monitoring, and long-term follow-up care. And the move comes amid growing concern over rising diabetes cases among children and teenagers in India. An estimate suggests that over 12% adolescents are pre-diabetic, while 8.4% already have type 2 diabetes. Health experts say sedentary lifestyles, junk food consumption, obesity, and excessive screening time are driving the surge, with cases now being reported even among children as young as 7 or 8 years old. So under the new framework, screening will begin at schools, anganwadis, and community health centers, where children showing warning signs such as excessive thirst, fatigue, frequent urination, or sudden weight loss will undergo immediate blood sugar testing. Positive cases will then be referred to district level NCD clinics for diagnosis and treatment. And doctors say early detection can prevent life-threatening complications and significantly improve the quality of life. And to help us with the way forward, we have Dr. Parjeet Kaur, Associate Director, Endocrinology and Diabetes, Medanta Hospital, and Dr. Srijit N. Kumar, Endocrinologist and Senior Consultant, Diabetes Care Center. A very good afternoon to you, Dr. Parjeet Kaur and Dr. Srijit. First, let me go across to Dr. Kaur. Dr. Kaur, how important is this mandate which says that children must be screened? What kind of an emergency are we looking at?
Right. So I would say it's a landmark move and much awaited move by Government of India for screening of children with diabetes. So here we are talking about basically two types of diabetes in children. Type 1 diabetes, which is still remains the most common form in children below 18 years of age. But at the same time, as you rightly mentioned, we are witnessing huge rise in type 2 diabetes cases in children. So for type 1 diabetes, I would say it's a huge move because these children, although we're diagnosed with type 1 diabetes, they do not have access to insulin, the monitoring, and the long term treatment. And what we face is that these children landing into a very serious complication called diabetic ketoacidosis if left untreated. Moreover, they do not have awareness. They go to alternative treatments, whereas insulin remains the only treatment of type 2 diabetes. So, take this initiative of screening children early before they land up into serious emergency and beyond screening, the lifelong treatment which the government is committing, it's a huge step because they need insulin for life. It's lifelong disease. They need insulin, they need monitoring, they need proper care. At the same time, type 2 diabetes, which is becoming increasingly common, is the one which can be prevented. In fact, this is much more a huge burden which we are witnessing of rising cases of diabetes in India. If we can stop in childhood, we can definitely reduce the incidence and prevalence. So I think this kind of a strategy where screening treatment should also be incorporating the messages about the public health awareness and children adopting a healthy lifestyle so that we can pick up these kids early and be aggressive about their health and nutrition for prevention of type 2 diabetes as well. I think it's a huge move. I'm really glad about it.
Dr. Srijit, your first thoughts on the statistics that are coming out, because over 12% of adolescents may already be pre-diabetic and more than 8% may already have type 2 diabetes. Your first thoughts, sir?
The rise is alarming. Now, if we just look at the data, we saw in the ICMR INDAG study, which was published last year, that 83% of adult Indians have some lifestyle disease, either fatty liver, cholesterol, hypertension, or diabetes. So that is a whooping 83%. Can you believe that? Now, what is unbelievable is that in 1972, the incidence of diabetes in India, the prevalence of diabetes in India was just 2%. So look what leap it had been. And moreover, what is even more alarming is that the age of onset at which we detect diabetes is fast coming down. So right now we have kids in their teens and even before that presenting with type 2 diabetes and fatty liver issues which are related with obesity. So that's an alarming trend. And if it goes unchecked, then probably the future is doomed. Now, what are we going to do? So it's very, very good that there is an initiative and there is a collective. And of course, we are not forgetting about type 1 diabetes, which is quite a challenging disease, and that needs a lot of support. But what is even more worrying is that the type 2 diabetes, which usually used to happen in the elderly age group, well past maybe 40, 50, 60, now it's coming in the teens. So it's absolutely important that we shape today's youngsters, as Madam rightly told, both through education, early detection, and prompt treatment to avoid a future catastrophe.
Or can a child completely look, fine and still be pre-diabetic? What are the symptoms that parents must watch out for?
Right. So definitely there are symptoms which are different in type 1 and type 2 diabetes in children. Type 1 diabetes actually appears suddenly. The child will suddenly lose weight, will feel very thirsty, will start urinating a lot, and will feel fatigued. So actually it's a matter of just 15-20 days type 1 diabetes. This is how we diagnose. But actually type 2 can be diagnosed way before the child gets the diabetes. That's the right question which you asked, how we can detect pre-diabetes. That's where we can prevent. So the pre-diabetes symptoms, very important, is the weight. So when the child starts gaining weight over a period of time, let's say a year or a two, along with that there are certain signs, subtle signs in the body. The darkening of the neck, that's a very important sign. Many times parents mistake it for the uh, just dirt, and the kid is not taking a bath properly, but that's not true. That's called sign called acanthosis, which is a sign of insulin resistance. So gaining weight, the darkening of the neck of the skin or the elbows or the underarms as well. Along with that, child is getting tired, and of course the physical behavior itself, that the child is more sedentary, eating outside food, and a strong family history. If the parents are diabetic, it's high chances, 80% chance the child will have diabetes. I think looking at all these risk factors, we need to be aware that this child is at risk of diabetes, and early screening is must in that child.
Vijay, once a child has been declared that he has type 1 or type 2 diabetes, is this reversible or even preventable?
You're asking me?
Dr. Srijit.
Acha.
Well, Dr. Srijit, if you could hear me, I was asking you if this is preventable or, even reversible.
Absolutely, absolutely. It is absolutely preventable, and that is actually the most important thing, because what we need to know is that this increasing rate of obesity, as I told you, it was not there 2 or 3 decades back, or even 1 decade back. It was much less, and that is precisely because there is a lot of food which is being eaten, and exercise has virtually vanished. So we need, for reversing that, we need to focus on the ideal weight, or rather the ideal waist. So I don't think that even you need to see whether your child is more prone or not, because uh, we need to assume that they are already prone, because the environment in which they are living in, not having diabetes would be an exception. By diabetes, I just don't mean diabetes. Along with diabetes, fatty liver, cholesterol, and all the other issues, like for in young girls, polycystic ovary, and infertility. All these issues are coming. So it's absolutely important that we just not only through these national programs, but even in our educational programs, in our curriculum, we should tell them and teach them how to lead a good life, which means they have to eat lavish on vegetables, eat adequate amount of fruits, take adequate amount of proteins, which are lentils, pulses, and also non-veg food, and cut down heavily on grains and sweets. And along with that, they need to exercise every day, aerobics, as well as thrice of 4 times a week, do some muscles as well. And it's absolutely important to maintain a slim waist, whereby not only that they will look good, but also they will live longer and healthier.